Hi everyone, this is Dr. Shilpa here. Today I want to talk about a very common and very bothersome condition, that is ingrown hairs. As the name itself suggests, here hair instead of growing outside is curling back into the skin itself. So our body will recognize it as a foreign body and causes inflammation. Thus, you can have bumps in the areas where ingrown hair has happened. So this can be asymptomatic, means you can stay without any symptoms, maybe slightly itchy, but they can also become infected, causing painful bumps in the skin and thus leave unsightly marks or scars on long term. So who can get this ingrown hair? So anybody who has a very curly and thick hair, the areas which are exposed to too much friction like the legs or the pubic area, underarms, the beard region. So these are the areas most common for ingrown hairs, but any area can be affected. The third thing is even genetics also play a role in case of ingrown hairs. Now, what are the causes that trigger the ingrown hairs? Improper shaving technique, if a person is too close to the skin surface, or they're shaving in the opposite direction of the hair growth, or very destructive like waxing or pulling, threading or epilation procedures, or a person who wears a very tight clothing like jeans which creates a lot amount of friction, or the last point where there is blockage of the pores which prevents the hair from coming out. Now, how do we treat this condition? Simple, treat the cause. You treat the cause, half the job is done. So, what can we do? First, correct the shaving techniques. Always shave in the direction of the hair growth. Wet the skin before you shave. Also use a prior shaving gel. And avoid waxing or any other destructive procedures as much as possible. Go for a permanent solution like hair removal laser. Hair removal laser, this is the only long-term treatment for ingrown hairs. Everything else is symptomatic. So this is cost-effective and also very long-term solution for ingrown hairs where we permanently destroy the hair follicles. Also, you can try simple lifestyle changes like try to wear loose, comfortable clothing. Don't sit for prolonged hours. We see ingrown hairs more common in the buttock or outer aspect of thighs in patients who sit long hours, because if you sit for long hours, what happens? The oil collects, sebum, dirt, everything collects, and also your skin is not able to breathe. So you yourself are blocking the pores a lot. So in these conditions, you can use exfoliators like glycolic acid or salicylic acid, which will exfoliate your skin and thus unblock the pores. And the last thing is always use a moisturizer. Don't be very aggressive in ingrown hair treatment. If you are having an infected ingrown hair, the doctor might prescribe you a course of antibiotic. If you are having the side effects or the sequelae of the ingrown hair like marks or scars, you might need a different treatment like a pigmentation treatment or a scar treatment. But for ingrown hair, it's more of a lifestyle change, and hair removal laser are the best options. I hope you like this video, and if you like it, please share with your family and friends who suffer from this condition. Thank you.